In a relatively introverted cultural environment, most of us are reluctant to talk about sex freely, and it still remains a taboo for most of us. However, sex is not shameful. Instead, it is natural and wonderful. It is not only a vital procedure of human reproduction but also the refreshment of life. Sex is essential, but you may fail it without adequate theories and skills. So what should we do to have a better sex life? For gentlemen, you can create a romantic atmosphere. Try to arouse your partner's sexual desire by stimulating her senses and mood with tricks. Change positions and rhythms to stimulate her vagina and other sensitive areas. These will help her to reach the peak of pleasure. Although sex is one of the most important sources of pleasure for humans, not all women can fully enjoy it. Women troubled by vaginal flatus or problems of PC muscles can hardly experience happy sex life. Pregnant, nursing, menopausal women or those on contraception often have no interest in sex. They may present with lack of libido, rigid sexual arousal, and orgasmic disorder. Some of them even develop dyspareunia. This is what we call female sexual dysfunction. But these barriers can be removed with some tricks. Apart from routine contraception, you should make sure that pelvic floor muscles are working, especially the bulbospongiosus on the both sides of vagina. It is vital for maintaining the contractility of vagina. The episiotomy and perineal laceration during labor will damage it and leads to the decline of sex life quality after childbirth. Sometimes, the pelvic floor muscles are referred to as love muscles, as a series of problems will come if the pelvic floor muscles malfunction, such as vaginal flatus and vaginal relaxation, which obviously affect the quality of sex life. We all know that sexual experiences sometimes determine the relationship between partners, so the repair of pelvic floor muscles is important. There are actually many methods for pelvic floor muscles exercises. One of the most effective and commonest is Kegel exercises, which improves the contraction and relaxation ability of pelvic floor muscles. Once you have learned to voluntarily control your pelvic floor muscles, you will easily get sexual arousal and orgasms. By the way, dyspareunia can be improved by massages, breathing relaxation training, and Kegel exercises. Of course, apart from these, electrical stimulation and biofeedback are very effective methods. Sexual dysfunction is common, and if diagnosed in time, your pelvic organs can regain their vitality, and you can get back your lost pleasure. Sex is a natural physiological and psychological need, and high-quality sex is fundamental to healthy partnership. Hope everyone can enjoy a perfect sex life.